Greetings everyone, my name is Sean, and welcome to my channel, Time for Evolution. This video series intends to make important academic research articles more accessible to the public. Join me in this quest for knowledge.
Background: coercion is routinely used in psychiatry. Its benefits and drawbacks are controversially debated. In addition, the majority of persons with mental health problems are exposed to stigmatization and are assumed to be dangerous. Stigmatization is associated with negative consequences for individuals with mental illness such as disapproval, social rejection, exclusion, and discrimination. Being subjected to coercive measures can increase the stigmatization of the affected persons, and stigmatization might lead to higher approval for coercion. Aims of the study. This study aims to examine the approval for coercive measures in psychiatry by the general public, and to explore its relation with person and situation-specific factors as well as with stigmatization. Method: we conducted a representative survey of the general population NN-ATS2207 in the canton of Basel, Switzerland. Participants were asked to read a vignette depicting psychopathological symptoms of a fictitious character and indicate whether they would accept coercive measures for the person in the vignette. Desire for social distance and perceived dangerousness were assessed as measures of stigmatization. Findings: the person in the case vignette exhibiting dangerous behavior, showing symptoms of a psychotic disorder, being perceived as dangerous, and treatment being understood as helpful increased approval of coercion in general, while familiarity of the respondents with mental illness decreased approval. Conclusions: the public attitude regarding the approval of coercion in psychiatry is highly differentiated and largely follows the current legal framework and medical treatment guidelines. Higher approval occurred in situations of self-harm or harm to others, and when coercive measures were thought to have the beneficial effect for the affected persons. A considerable part of the approval for coercion is predicted by stigmatization. With the increasing severity of coercive measures, the influence of person and situation-specific factors and of familiarity with mental illness decreased, and generalizing and stigmatizing attitudes became stronger predictors for the approval of more severe measures. Introduction. Numerous studies have shown inconsistency in patient-related factors that may contribute to an increased risk for coercion. These include diagnosis, level of aggression, socio-demographic, and socioeconomic characteristics. Concerning dangerousness, numerous studies found that persons with actual or impending danger to self or others are at high risk of compulsory admission, 17-18. This is the case despite the lack of robust empirical evidence for a positive immediate or long-term effect of coercive measures regarding aggression and suicidality. A review of 36 studies, e.g., found insufficient evidence for the short-term effectiveness of coercive measures to reduce danger to others and oneself in psychiatric settings. 19. Objectives. This study aims to examine the approval for coercive measures in psychiatry by the general public and to explore its relation with person and situation-specific factors, as well as with stigmatization. The present study aims to measure the extent to which the general population approves the coercion of individuals with mental disorders. It examines whether established indicators of mental illness stigma such as desire for social distance and perceived dangerousness are associated with the approval of coercion. The public's beliefs about the benefits of coercion were examined regarding their association with the approval of coercive measures. Methods. We conducted a representative survey of the general population, NO2-207, in the canton of Basel, Switzerland. Data for the current study stem from a vignette-based representative population survey on psychiatric service use and stigmatization that was conducted from autumn 2013 to spring 2014 among citizens of Basel, Switzerland. A sample of 10,000 individuals was randomly drawn from the cantonal resident register and was mailed study material. Participants had to have been registered in a private household in the municipality of Basel, Bettingen, or Rehen for a minimum of 2 years, had to be aged between 18 and 65 years, and had to have sufficient knowledge of the German language. Informed consent was obtained from all study participants. They agreed to return the completed survey material. Participants were informed about the scope of the study and their rights in an accompanying letter. Results. The person in the case vignette exhibiting dangerous behavior, showing symptoms of a psychotic disorder, being perceived as dangerous and treatment being understood as helpful increased approval of coercion in general, while familiarity of the respondents with mental illness decreased approval. The logistic regression analysis revealed that endangering behavior, perceived dangerousness, type of psychiatric diagnosis, familiarity with mental illness, and whether treatment was perceived as useful were significant predictors. A Bonferroni-adjusted post-hoc analysis revealed a significant mean difference, MD, in the approval of coercive measures between information that the fictitious person endangers her, himself, MD, E0131, P001, 95% CI 0.099063, or others, MD X0128, PN001, 95% CI, lower 95 0.60, versus information that the fictitious person endangers no one at all. There was no significant mean difference between the information that the fictitious person endangers her, himself versus information that the fictitious person endangers others. MD A094 P005 95% CI 0.28 0.37. Discussion. This vignette-based survey is, to the author's best knowledge, the first study to examine approval of coercion in the canton of Basel, Switzerland, in a representative sample of the general population. In accordance with the legal requirements as detailed, the opinion that psychiatric treatment is of use for the fictitious person was associated with a higher approval of coercive measures in general and for all individual types of compulsory measures examined. Approval of coercive measures in psychiatry by the public seems to be in agreement with the current legal framework and in line with the model of beneficial coercion, which argues that coercion can be necessary in mental health care to ensure that people with psychiatric disorders who avoid treatment and medication, but are a risk to themselves or others, receive treatment, albeit involuntarily. 50. When examining the different coercive measures explored, only self-endangering behavior was linked to the approval of involuntary hospitalization and involuntary medication. Endangering behavior was not associated with the approval of seclusion. Conclusion. The public attitude regarding the approval of coercion in psychiatry is highly differentiated and largely follows the current legal framework and medical treatment guidelines. In Basel, the public attitude regarding approval of coercion in psychiatry largely follows the current legal framework, with higher approval in situations of self-harm or harm to others, and when coercive measures are thought to have a beneficial effect for the affected persons. In this context, a close cooperation with additional inputs of the general population in scientific and treatment-associated questions in psychiatry might be seminal and of additional value for the future. Reducing stigmatization and misconceptions about the dangerousness of persons with mental illness and increasing familiarity with psychiatric patients seem a vital and essential task for clinical psychiatry to further decrease coercive measures in the treatment of persons with mental disorders.